I'd like to thank everyone, both our participants and students, for showing up for the afternoon seminar series. Again, we have a pretty diverse group of individuals today, and a lot of them are either in the medical field or potentially pursuing a field that has a medical bent to it. You can introduce yourselves briefly, and then if you could give us a short synopsis of based on the field that you're in, what your day was like pre-pandemic and what your day is like now, mid-pandemic. And it doesn't matter to me who starts. So.
All right, I'll take a swing at this. My name's Chris. I'm a 2013 Norwin graduate. I am a critical care nurse for Allegheny Health Network. I work in the intensive care unit. So my life at work before this pandemic was working in the ICU. It's a lot similar to the emergency room, but yet it's a lot different. 1 minute you're sitting there just charting vital signs, and the next you're running around because people are trying to die. And it's a roller coaster. It's an up and down. With this pandemic now coming through, my day, generally the hospital has had less patients, but our patients that are in the ICU are sicker because they're not coming to the hospital unless they absolutely have to, sometimes a little later than they should. Some of them have this coronavirus, others do not. Currently at work, we have, in my ICU right now, we have, when I actually left at 7 a.m. this morning, we had 6 patients. One of them was positive for coronavirus. Gearing up for isolation, you have to put on what looks like a whole hazmat suit to go in. They're in special negative pressure rooms. So physically, to go in and assess the patient, if something goes wrong, you can't just run in the room if their heart monitor goes off. You have to put all the gown on, the gloves, the goggles. We have specialized N95 masks, or we have these what are called PAPR respirators that purify the air. The negative pressure rooms are generally smaller, so you have less room to work with, and we're putting ventilators and dialysis machines and everything in them. So it takes a lot more time to do everything we need to do.
All right.
And it's not very, if you have to go in an emergency, you see how quick you can get the gear on.
Right. That's probably been a lesson in and of itself. All the stuff that you knew was in the closet, but you never knew you needed to use. That's all right. Thanks, Chris. Thanks. Who would like to go next?
I'll go if you want me to.
Sure. Thanks, Emily.
So right now, I am a student at Juniata College. I was Norwin class of 2018, and I am studying environmental chemistry and pre-toxicology. And toxicology is basically the field of toxins. It's how drugs and chemicals and just anything you can get in your system interacts, what it does to you. It's a really kind of neat, unusual medical adjacent field to go into, I guess you could call it. But that's where most of my work is right now. And before the pandemic, I was just living my normal college life. I was just saying before the students came in that I lived with 6 roommates. I got up every morning. I would go to class as normal. I was a TA, so I would go and TA my labs and see students. I would do my campus activities. Just pretty much everything you'd expect of your normal college experience, I was doing every single day. And then I came home for spring break. And first spring break was extended, and then the semester was canceled. So now my life just looks like living at home with my parents. I'm very much confined to North Huntington again, as I was living in Brooklyn before this when I wasn't in college, and that was way different from here, but I didn't want to take the risk of staying there. So as a college student, and if this were to happen again while you guys were in college, what I'm seeing is all of my classes are online. My labs, they're not able to do the physical part of the lab where they actually create things and synthesize different compounds. Instead, it's just a lot of worksheets, a lot of video calls, a lot of forums, and I'm adapting. Like, that's the most anyone can do right now.
Right. Thank you, Emily. Thanks. And Heather, how about you?
Well, hi guys. I graduated from Norwin in 2012 and went to WVU for undergrad, and then West Virginia School of Osteopathic Medicine is what I'm in currently, and I'm a third-year med student. Before the pandemic, I was in my third year of med school, still am, I guess. And in third year and fourth year of medical school, we rotate around the hospital and see all the different specialties that exist within the field of medicine for 2 to 4 week periods. So I had made it through all the core ones, which are internal medicine, psych, EM, emergency medicine, OB-GYN, all the cool stuff. And I was in my second round of internal medicine when they kicked all the med students out of the hospitals because we take up extra protective equipment. And there's just a lot of extra bodies. So we got kicked out and we've been online ever since. So most of my learning is online, which is not equivalent to being in the hospital, but oh well, making the best of it, hoping to get back out there soon.
Okay, thanks. And then both Heather and Chris mentioned the idea of the PPE, the personal protective equipment and stuff like that. Heather, could you go into a little more detail what you were saying in terms of like what's the reason why they kicked you out?
Yeah, sure. The beginning of this, I think, so the hospital that I was at already had a shortage of protective equipment. So in surgeries, that's gowns and gloves, masks, face shields, all that kind of stuff. And so they were already starting to be a little bit careful. What happened is a bunch of our packages got recalled and they had to throw a bunch of stuff away. And then they were really short already. And then when this all came along, so med students have to use all that equipment and then someone else has to go in and check all of our work after that. So another doctor has to go in. So it's like 2 instead of 1 to use up unnecessary equipment, really. So they could do the same job without us. Plus we take time to teach. So we just feel like tagging along. And they need to get stuff done without us nagging about certain questions. So.
And that's been across. Is that been a standard policy? I mean, your other friends are in other med schools. It's the same thing.
Yeah.
They all sort of got bumped.
So it was the national accrediting bodies decided that we should all get pulled, so it was fair for everybody.
Right.
So it's been kind of nice because I mean we're all getting delayed, so everybody has the same playing field for residency.
Okay. Well, again, so we have 3 people. Sort of in very different states of their careers in education, so a nice spectrum. And before we move on, there was a quick question. Chris, there was a question to you about a negative pressure room. Do you want to real quickly explain what a negative pressure room is?
So a negative pressure room is a room, it'll have 2 doors to get into it. You have one door you walk into and it has like they call it an ante room or a prep room. And a lot of times it'll have like a sink, it'll have some shelves, you can hold your isolation supplies, cleaning supplies. It might even have a computer, someplace you can store your medications and if you're doing any bedside procedures. And then when you walk into the second, you can put all of your isolation, your gowns, your gloves, your mask, your respirator, whatever you need, you can put on in that ante room. And then you walk into the second room, which is where the patient's actually at. And negative pressure rooms have their own ventilation system. So the air, whenever you breathe, and you use patients that are in airborne precautions, so simply the germs you don't get from touching one another, you get because they circulate in the air when they're just breathing in and out normally like us. So it has its own ventilation system that's separate from the hospital, has its own filtering system, and it actually goes into its own collection chamber separate from the hospital, so you don't get the airborne germs through the rest of the hospital. Typically, the thing, just to give you an idea, it's our hospital policy is right now, or a network policy rather, if you are a COVID patient, if you're a rule out or a positive patient, the only time we're requiring negative pressure is if you're going to be on a ventilator or we're doing some sort of invasive respiration such as a BiPAP or CPAP, something that will aerosolize the particles and spread them through the air. If you are not on a ventilator, not requiring any CPAP or anything, you can go to any room and we just close the door and anyone going in has to wear a mask and gloves and we do a deep clean every day. Besides this coronavirus, things we isolate for negative pressure would be active tuberculosis, viral meningitis, things like measles or mumps, rare things. Before this virus, my 2 years of working in my hospital, I had 2 patients we put in there. One was a rollout for viral meningitis, and the other one was a rollout for active shingles. Mm-hmm. So besides this virus, it's pretty rare to use a negative pressure room.
Was it the room where you guys stored all the stuff when you didn't?
Yeah, it's the room way in the corner. The lights are always off. The flickering light. Yeah, it's not used too often.
All right, thanks, and thanks to the question from Chad again. That was a chat question. So anybody who's watching, if you guys have any questions about anything they say, or if they refer to something, by all means, please feel free to put it in chat, and they'll be happy to address those as well. So, where do you see the challenges in terms of communication, working with other people? Where do you see maybe some of your strengths, and maybe some advice to our students, especially when working in groups, how to work effectively, since you guys are all coming at it from definitely different perspectives. So.
Yeah, I can start if you want.
Sure, absolutely, thanks.
Communicating in groups. In undergrad, I really didn't care for group projects. I think that's there are a lot of people that don't like group projects. Well, I don't know, maybe it's type A people, I'm not sure. But it seems like there would always be a group of 5 and like 3 or 4 didn't really want to work and 1 would. And I don't know, some people don't want to they go right up against the deadlines, but some people want to be 3 days ahead of the deadline. So there's definitely different personality types, and there's a lot of leadership questionnaires out there that will tell you which type you are and which leadership style works best for you or works best for the people you're managing. So I took actually taught a professionalism and leadership course in med school in my last year. There were 4 of us that kind of taught this program.
You said you taught a course?
Yeah.
Oh, wow.
The year before. It was a pretty good experience. We got a lot of guest speakers and stuff that have a lot more experience than us to supplement. But a lot of it was focusing in the medical field on being good listeners and respecting all levels, because there's a lot of hierarchy in medicine. Respecting all levels of education and the opinions at those levels, and how much time people spend with patients, and knowing that you might not be the best representation of what that patient is feeling if you're not the one spending the most time with them, that kind of thing. Most of the leadership program focused on communication and listening. There was one quote I saw that said you should listen for 5 minutes and talk for 1 in a given meeting, and that's really stuck with me. It really stuck with me in terms of, obviously this kind of stuff, it doesn't work as well, but huge meetings, right, where a lot of people have a lot of stuff to say, it's really been beneficial. But yeah, it takes a lot of time to build up good communication and respecting people's, just personalities and levels of, being rushed to get deadlines and stuff like that. But in the medical field, yeah, teamwork, emergency medicine, that's all they say is teamwork. So hopefully I'll be good enough at that to fit in with them. But
no, that's great. Yeah. That's exciting. You had an opportunity to teach that course too. That was probably a pretty good experience. A lot of good advice. Awesome.
Yep.
Awesome. All right, cool. Anybody else want to play off that, add their own ideas about the
I can talk more about kind of the educational sense of in undergrad as far as communicating. I've noticed a lot with research, especially being in kind of this odd conglomerate major, that while it was a good bit chemistry, is also just a lot of biology, a lot of environmental science. It is kind of difficult if you come in with a major like that to find your crowd of people and to find your voice as far as the communication with certain projects. Like a lot of research are just all the biologists or all of the chemists. And this can end up being a good thing, actually. Like the research I'm in right now, I'm kind of leading the whole chemistry end of the project. It's good to sometimes be differentiated, because while that can be isolated at times, you can also be having more independence with what you're working on, and you can take more control of projects. So if you are a leader, that's a really, really good thing to do. But also there are other communication issues with being undergrad, especially a lot of my classes. A lot of times there is a language barrier, and that's important to talk about, because I do go to a very international college. So that comes up sometimes, especially with some of my students coming from other countries they have very, very good English, but it's not quite their first language, and they don't quite have the full technical repertoire with it yet. So that's definitely a big issue with communication undergrad, although it's not insurmountable. Just because there are people coming in who aren't as familiar with the academic English and stuff, it's not an insurmountable barrier. There are things to work around and ways to kind of work out all the little kinks. So while there are, I think, a few very common communication issues you'll run into undergrad in any science career, and you will butt heads in research, you'll butt heads with saying, I want to take the project this direction, I want to take it this direction. They're all things that can be easily overcome, and they're awful, and you get scared and panic in the moment and think, oh, okay, it looks great, this project's never going to work out, but it all does in the end. And even though these things do come up, it's not something to be afraid of or something to shy away from. This is what I would add, I guess.
And a reminder, if anybody came in a little bit later, again, Emily is only in her second year of college right now, but she's already taking courses. And again, she's a Juniata, so there you go. Nice opportunities at Juniata. So you got to be an A+ student. Got to be an A+ student though, right, Emily? So.
If you want to TA that young, you just have to get an A in the course as you're like an older student. But if you want to TA as a sophomore, you have to have really good grades in the course.
Yeah. And that's a good point. Just before I take Chris's answer too, when you are at your campus, if that's the direction you want to go, take a look out for opportunities. They didn't necessarily chase Emily down for that opportunity, but you got to sort of keep your ears open for what's out there, and then try to put yourself out there and get those experiences that are going to make you stand out when people are looking to hire you to a job or accept you to a graduate school and stuff like that. So Emily's going to have an advantage over her peers because she is doing the extra work and taking the extra effort and showing the initiative.
Yeah. There are opportunities everywhere too. Like I have already set up my internship for next summer. So stay on top of things too. Like really, if you think it's too early, it's probably not too early.
I'm worried about like May 8th right now. I'm not worried about next summer. That's good. Excellent. All right, Chris, what about you?
The only thing I'm going to add is the phrase "you're only strong as your weakest person" is the best way to describe having to use teamwork and work with others in medicine. We have a saying that there's no I in team, but there is an I in nursing. When in my ICU, we have very sick patients that need to have multiple things done. I have medications that I have to give them. The doctor wants them to go for a CT scan. They need to have a bedside echocardiogram done, and whatever else. And all those things need done. What takes priority? What needs to be done first? Who needs this? And then, God forbid, you have someone who takes a turn for the worse down the hall, and you have to go help that nurse. So it's a lot of intercommunication. That's the best thing. You're only as strong as your weakest man. So you communicate with your other nurses and your supervisors and the doctors and to get whatever you need, and you work together, you prioritize, and you get done what needs done. At the end of the day, it all gets done and the patients are taken care of. But the communication is you have to communicate. If you need something, people don't know to come and help you if you don't tell them. And the same goes the other way. You don't know to help other people. I can ask you 1,000 times, do you need something? If you tell me no, there's nothing I can do for you. But the biggest thing is just communicating, just make sure everyone's on the same page.
Is there somebody whose job it is specifically to schedule? Like, I mean, when there's somebody that needs like 6 different things done in a day, so I would imagine there's a lot that needs to go into that, right? There
is. So in the ICU, unless you're going down for a CT scan or MRI, most of the stuff can be done at the bedside, which is good for me because by the time I get all your tubes and wires situated, you could have just came up and did the test anyways. And a lot of times those patients are too sick. They're on basically life support sometimes, and you can't really take all that stuff with you down the hall. Mm-hmm. So it's when the doctors come in the morning and make their rounds and they want these things ordered, you kind of take priority on, you learn to adapt what needs what. A CT scan, you can get a CT scan any time of the day. That's open 24/7. But if someone needs a ultrasound of their lower legs, they might only be there from 8 to 5 and 8 a.m. to 5 p.m. But if the CT is urgent because there is a change in their mental status and you have to go get a CT emergently, then that takes priority. So that comes with, you learn a little bit about prioritization and delegation in nursing school, but a lot of it comes with on-the-job experience. You learn, hey, this patient needs this now. They can get that later. They need to do this, or I have to give them this medication first before we do this. And you learn what takes priority. And the doctors a lot of times too will say, hey, I want this and this, but we need to do this first. So again, it's communication with the doctors, and the doctor will say, I want this test first. And I'll tell the doctor, okay, that's great if you want that, but I need this done first. I need you to do this for me so I can do that first. And it's teamwork.
Heather, does that sound like, the training and experiences that you've been getting? Has that been an issue that you guys have been sharing in terms of working as part of a team to get the thing done in a day?
No, I definitely know what he's talking about with certain departments being open certain hours and trying to figure out which one you can get to first. But I think our school, and so far all the training I've had, like pretty much from every preceptor that I've learned from, has stressed the importance of nursing staff. And if you get along with your nurses and you help your nurses, they will save your butt sometimes when things are tough or you make a bad decision, they'll call you on it. And that's always good. So for the benefit of the patient. So pretty much everyone has told me that, which has been great. So, and it's true. I mean, nurses are really nice and helpful if you give them what they need.
Good. Excellent. Awesome.
A dozen donuts and a cup of coffee goes a long way in the morning.
All right, I'll keep that in mind.
Okay, there's a question from the chat specifically about how hard is it to and if you're out in the field, you can sort of think back to when you were in your studies. What are the challenges and benefits of good communication with your professors? Is it tough to get good information out of them and get help when you need it, or do you find they're in pretty good shape? Any lessons for dealing with professors and stuff like that?
Is it okay if I?
Yeah.
Well, I find that when you get to college, you settle really heavily into your life advice professors and your academic advice professors. So and I think this is true for not just me and my friends in my own college, but all of my friends in my grade. You have the professors that you learn that you can always go to if you're like having personal problems or just want to sit and cry about a test or something. And then you have the professors you decide you can go like, okay, well, I need to find an internship, or I need to get on research, or this class isn't working out. What do I do? So good communication can take several different forms with professors. Not all of your professors are going to be wonderful in the advising. Some of them are going to be better just to sit and listen and kind of help you rationally sort through your thoughts about classes, while some are going to be super goal oriented. Like, okay, you want to do getting an internship, you need to look on this website, find 10 different internship people you like, call every single one of them. Okay, out of the 6 that followed up, now you need to check in with them in 3 months and in 2 months. So some will give you that really rigid pathway, and that's great to have. And then some will give you kind of more of the just, you've got this, like you're good, just keep trying hard. And the downside to that also is there are always going to be the professors you don't get along with very well. It's just like high school, where there are going to be teachers you just don't vibe with very well, or you butt heads with sometimes. And that happens. But in college, I feel like you have a lot more of an environment to say like, hey, I don't think we're getting along great. What's the deal with that? Like, you can talk to your professors and say like, hey, I want to have a better relationship with you than the current one, if you did have like a little spit over a test grade or something. So yeah, you do have the good and the bad relationships in college, just like you would in any academic setting, but there is a lot more opportunity to improve the bad and a lot more opportunity to just build upon the good, I think. So that is one advantage to being an undergrad.
Heather, what about in the grad level environment there, the med school environment?
Yeah, so I have a big school experience and a small school experience, so I can kind of, at WVU in undergrad, it was definitely really big, and I didn't know a lot of professors. I mean, like, I never talked to some of them because my classes were like 300 people big, and I didn't have an issue, so I didn't need to. But in the upper levels, junior, senior years, when classes get small and you can kind of really get to know professors. But in grad school, our class is only 200 each med school class, which is kind of big for a med school class, but our school is only a med school, so all of our professors just teach us. So I did get close to a good bit of them for my 2 years down in Lewisburg. And it is really nice now to have like so many mentors that I can count on, just because some of them are doctors, some of them are medical doctors, and some of them are PhDs. Mm-hmm. But it's nice because if you get so close to them and they know you're driven, they'll just be like, hey, do you want to help me with this project? And then you can kind of work on some more projects and things like that. But in undergrad, office hours were generally very utilized, I think. So if you did need help or have a question, they're always there to help you.
Sorry, you cut out. You said they were underutilized. Is that what you said?
Yeah.
Okay, yeah. For
sure, I think. I mean, and one of my roommates is a GTA and master's in biology right now, and like nobody comes to his office hours. Mm-hmm. I think everybody's doing that, but people just don't come. I didn't go either, but if you did need help, they're definitely there.
Yeah, I would say that does mirror my experience. Well, again, I've been out for a while, but yeah, the office hours are an awesome resource, and you may find that a professor that might seem a little standoffish or a little cold in class, when you're sitting across from him or her in their office, they're a lot more warm and personable, and very, very respondent to individual concerns and stuff like that. So yes, office. Yeah, I do absolutely recommend that too. Office hours are a great resource that our that yeah, not enough people take advantage of, I would imagine. So Chris, how long have you been out of school for now?
I've been out of school for just over 2 years now, but I'm actually taking online classes to get my bachelor's to master's program.
Okay, that's awesome. Now, when you went to school, what kind of program did you go through for nursing?
I went through Westmoreland Community College. It's a 2-year community college. You have your prerequisites you take. You have your anatomy, physiology. You take a psych, you have to take a pharmacology. All your prerequisites to get in the program, and then the nursing program itself is 2 years. A fall, spring. Mine was actually a hair longer because halfway through, I learned I needed money, so I switched to the evening program. So I graduated 6 months later than everyone I started with, but I actually really enjoyed the evening program. If I know a lot of the kids now, they're not morning bird, they're not early birds like me. They like to stay up till play Call of Duty till 3 a.m. or later. So my evening weekend program, it was the same days of the week, whatever days, if you had to go Monday, Wednesday, Friday, or Monday, Wednesday, Thursday, whatever it was, same days of the week. But my lectures were from like 5 p.m. to 9 p.m. and our clinicals were 3 to 11. And honestly, by the time we were done passing the evening medications at 9 o'clock, we had a quick little post-clinical huddle, and we were out of there by 9:30.
All right.
So that is an option for anyone who, if you're like me and need it to work, or if you have kids and you have to wait till your significant other gets home to watch the kids, or if you're not a morning person, don't want to wake up at 6 a.m. to drive to the hospital or to college, you can do the evening program. And I actually really enjoyed it. Classes were smaller. You had completely different instructors who did the evening program. I wish I would have did the evenings from the get-go. If I would have known how much I liked it, I really did.
Do you find it's harder to reach out to your professors with evening hours, or are they still pretty available too?
They're still pretty available because they're going to be there in the evening with you. All of our instructors had they had regular office hours and they had virtual office hours. I think almost every one of my instructors, they checked their email every day. A lot of them gave us their personal cell phone if we had a question. Obviously we had to call off clinical sick or something to call them, but you could also call them with questions, or if you weren't sure about something. I do agree with what you said about schedule one-on-one if you feel like that there's an issue in the group, because I've had a couple instructors in nursing school, especially at the beginning, who they're teaching, you're not getting this, and they're like, I don't know, like they almost seem like they don't know what they're talking about because no one in the group's getting it. And then you schedule a one-on-one, you're like, wow, this person actually is like a really good nurse and they have all this experience, and the one-on-one really did work better. The other thing my WCCC offered, their nursing program, it's essentially a tutoring service. I forget what they call it. Their clinical something. It's basically a tutoring program, and every day, Monday through Friday, from like 8 a.m. to 5 p.m. and then for evenings you can schedule an appointment. You could go and get extra one-on-one or like small groups of 3 or 4 help on anything. And they could, I know a lot of us, none of us did too good with our GI unit when we covered it. So we all scheduled things and we review different GI issues and symptoms and diagnoses, and we reviewed a test when we did bad. If you're lacking on the clinical side, you're not good at listening to heart sounds. You can never find the person's heart sound on their body. They'll set up a simulator. You can go in and just practice listening to all the different heart sounds. And that was another really cool, is the tutoring and the extra lessons or extra help you could get.
And I would add to that too, in terms of, if anybody's thinking about going into the nursing program, again, I'm just familiar with some of the stuff at the WCCC program, but they do have a crazy ton amount of like simulators and like fake bodies and like all kinds of crazy stuff that you can use to, and again, I know sometimes there's a bit of a stereotype of like a community college education versus a 4-year degree or something like that, but they have like all the craziest they showed me the one, like it's an artificial person they could like simulate that could give birth and stuff like that. Like, it's crazy. And again, these are super crazy expensive machines. So, there are, the education that you can get out of a community college education is just as solid and pretty smart, financially savvy as well.
It is. You know, I don't talk bad on any college or any university, but I have friends that are going to big 4-year universities, and they're talking about how, you know, this is my first year and I already have so many thousands of dollars in student loan debt. And I go, bro, that's how much I had for my whole community college education.
And plus, you're out earning money now too. I mean,
I am.
So there's your friends who probably aren't even done with their program yet. And you're already been 2 years in the field. So yeah,
I am. It is everyone thinks, you know, that there's nothing wrong with community college. Again, I'm not talking bad on any program, but it doesn't matter if you go to Shady Side School of Nursing, if you go to WCCC, or you go downtown to Pitt, Maine, and go to nursing school. At the end of the day, we all take it's the same curriculum. We all take the same state boards, and we all get the RN at the end of our name. So it truly does not matter where you go.
Awesome. Cool. All right. What about share with us your best professionally related day that you can think of in moderately, maybe it's pre-pandemic, but you know, what was the day that was the most satisfactory to you where you're like, yeah, this is exactly where I'm supposed to be right now? Oh, I'm sorry, Emily. I think I turned it. Hold on. Sorry. I was getting some feedback off your mic, Emily. So if you want to start.
Sorry, my dad's having a Zoom meeting in the room across from me with his students.
Oh, God, be quiet, man. Be quiet.
Yeah, my dad's a nursing professor, so.
Oh, that's awesome.
Oh, awesome.
Yeah.
Anyway, yeah, my best moment was probably with I have this professor, Dr. Baran. He is a wonderful professor. He's from Czechoslovakia, so you can picture like the heavy accent there. And one day, and he just keeps telling us, I have a secret. And we walk in the lab for inorganic chemistry, and there are torches. Every lab bench has a torch. So we're like, okay, what are we doing with these torches? And in that class, he said, surprise, we are going to learn scientific glassblowing. And we did a whole surprise glassblowing unit on how to make the volumetric flask and how to make all of the instruments, basically, like the good old-fashioned way, and calibrate them. And that's a really cool skill to know. Like, I know how to make scientific glassware, and I probably sound like such a nerd right now during this. But I just thought that was probably the most awesome moment of my education, walking in and realizing, like, I felt like I'm learning, like, the ancient arts of chemistry. That was my favorite moment.
That's good. Neat. That's neat.
Yeah, that's cool. For me, mine was actually, so I want to do emergency medicine or family medicine, but my favorite memory probably of this year was in obstetrics and gynecology. I'll keep it PG. But so I was on OB, which is delivering babies, in January, and I had this great preceptor who is also a DO. And
can you explain what a preceptor
is? Oh
yeah,
sorry. So it's like the big doctor that like did all the schooling ahead of me, and they teach us baby doctors how to be big doctors. So just a teacher. I got a different teacher like every month in a different field. So she was my teacher for OB-GYN, and every week they take call for women who are delivering, and I told her that whenever she had call that she should call me because I wanted to see first, because that's what I'm there for. But like they don't always do that. But this was my third delivery, I think, and one night she called at like 1 a.m. and I had like all my stuff laid out because I was so excited to go. If she called, because I went to bed knowing someone was in labor, so I had all my stuff out, like keys were in the car, I was ready, and I live really close to the hospital. So she called and she was like, hey, if you want to come in and see this, you can. And so I got to the hospital in like 4 minutes, I think, like pretty speedy, and then like walked in, and the woman was ready to give birth, and she let me do it, and so I delivered this baby. Yeah.
Oh wow.
With her standing right next to me, for safety, but. And all went well. And yeah, that was probably the coolest moment of my medical education so far.
And that didn't tip the scale, so you're still happy with family or emergency med, was it?
Or emergency, yeah. I liked it, but I didn't want to do that every day.
You're like, oh, that's good. I had the experience.
It's too much of the same thing. Yeah, right. I had the experience. I'd check it off the box, but I don't want to do that every day. I need a little more variety.
Chris, how about you?
So I have two. When I was in nursing school, I worked as a paramedic, and I still do for North Huntington Township. And for the longest time, I thought I wanted to work in the emergency room. You know, working in EMS, you get that emergency medicine. I thought that's what I wanted to do. I remember one day in the ambulance, we had this 3-year-old kid that was having a seizure. And he was having a real bad seizure. We couldn't stop it with the medicines we carried on the ambulance. So instead of taking the children's, we took him to Forbes Hospital because it was the closest. And just at that whole experience, everything that happened, it's a kid. They have the parents there. They're panicking. All the neighbors are there. You know, everything. And then we get him to the hospital. I'm driving like 100 miles an hour trying to get to the hospital. Just that whole experience made me realize that just being able to help him. And this was 4 years ago. And to this day, I don't ever know what happened with the kid. I don't think we ever will. But just that whole experience, being able to be there and to help him confirmed that I wanted to work in medicine. And when I was in nursing school, I said the longest time I thought I wanted to work in the emergency room. That's what I did on the ambulance. I love the fast pace, the adrenaline, the not knowing what's coming through the door, the unpredictability. I love that. But I had this patient in nursing school that really geared me towards the ICU. And after I've been working in the ICU for a year, because I love the medicine we do up there. You can follow the patient, all the different things on how to actually fix them. You know, in the ER, you just kind of patch them up and send them to me in the ICU. The ICU, we follow through all the different medicine. You're contacting cardiologists, pulmonologists, you know, nephrologists. You're consulting all the different specialties to manage this really sick patient. We had this patient about a year ago. And these numbers won't mean anything to Jens, but Heather will understand them. This guy was in complete renal failure. He had a BUN of over 200 and a creatinine of 10.
I saw Heather's eyebrows lift at
that.
This guy should have been dead. He came to the hospital because he was not able to pee for a week. And these numbers were so high, he just went into renal failure. And we actually had to restrain him because he was so delirious from all the toxins building up in his body that he just kept trying to climb out of bed. And he wasn't trying to hurt us, but we would go in to give him medicine and he'd start swinging at us like King Kong because he was just so delirious. And he was in our ICU for a week. And of the 7 days he was there, I was his nurse for 4 or 5 of them. And he was like a one-on-one patient. Every hour you were giving him a different electrolyte. He was getting dialysis. You had to give him a different medication. You had to physically do something. And it was tiring at the end of a 12-hour shift. But the best feeling was 2 weeks later when his wife brought us a tray of cookies and he walked home out of the hospital. And he came and thanked us. And he had no idea who I was. He came and his wife goes, "Do you know who that is?" And he goes, "No." I said, "My name's Chris." I said, "I was your nurse when you first came into the hospital." And he goes, "I had no recollection of you." I said, "I didn't think you would." I said, "Your numbers were so bad, you should have been dead." And I said, he was so delirious. And he had no recollection of anything that happened over those 7 days in the ICU. But just to see 2 weeks later how sick he was, he should have been dead, him to walk home out of the hospital. I said that was not everyone gets to do that. Not all my patients get to do that. So that was really, that's when I found like, yeah, this is what I want to do.
All right. No, those are all great stories. That's awesome. And hey, Emily, also, if you liked glass blowing, Pittsburgh does have a glass center. I don't know if you know that or not. There's like a center. If you've got the hankering for blowing glass, you can actually take it up as a hobby. And there's
I would love to do that. I've never done like the artsy. Like I only know the functional glass blowing. I actually have something I think I made right here. 1 second. I'm gonna take my camera off. I actually have something right here.
It's like a surprise. Okay.
Okay.
All right, we'll go.
So, really little thing. I made much more intricate stuff like this, but whenever we after the glass blowing unit, whenever we synthesize chemicals, we got to put them in we got to make the ampoules.
Oh, that's actually like a tiny little, what was it called? An ampoule?
Yeah, and I actually completely blew all these myself, and these are very simple. We did like way more intricate stuff, but whenever we made chemicals in inorganic chemistry, we got to blow the glass ampoules and put them in there and seal them off and keep them.
So it's like sealed at the top. So that's like a hermetically sealed like little containers. Is that how they used to store
how they
chemicals?
would do it in the lab, and I think there's actually, you can see around here, you would get score right around like this little indent and then break it. And then that's how you would get the chemicals out if you wanted to get them out of these. But they're completely airtight.
Huh.
But yeah, that's one of the little fun things I did. Although I have to check that out because I did absolutely love it. I'd love to get into like the more of the art of it.
Yeah, no, again, there's like people that do like, there's displays of like scientific glassware too, where people have been blowing. Yeah, Pittsburgh, I think it's called the Pittsburgh Glass Center. We've been there. It's just, for the record, if you didn't know about it, it's kind of a fun. Once pandemic lifts, if you really enjoy it.
Oh, I know. I was already planning a trip to the Corn and Glass Museum next
Oh,
semester.
I went there.
Hopefully things are good by then.
Excellent. All right, now I know I had you guys on till around 1:45, so we'll wrap up with let's say one more question, I guess, and then I don't want to keep you guys any longer than I said we'd have you. Why don't we go with sort of the classic? If you had one piece of advice to offer like yourself like 6 years ago, what would it be? Like actually, I think this morning we phrased it as one piece of advice and one warning to yourself. Like 6 years ago is an arbitrary number. You don't have to necessarily stick with 6 years, but yeah, a piece of advice and perhaps a warning that if you could throw back to the past to give yourself, what would it be?
I'm probably the closest. I mean, 6 years ago for me, that would be
You don't have to stick with 6. You could say 4. You're a young person.
6 years ago for me, that would be my freshman year of high school.
No, maybe a little bit later than that. But.
Yeah. As a high school freshman, for my piece of advice, I would say just embrace fluidity of situations. And that's especially important right now. And I don't mean it to be so cliche, but embrace that you don't know what you want to do yet in college. I wanted to do public policy when I went to school. Like, embrace that you don't know as a freshman and that you don't know your future, and just kind of enjoy the fact that there are going to be so many things you think this is awesome and this really is bad and I hate it. And just absolutely roll with it. Don't try to pre-fit yourself into a major too early or anything like that, just because ultimately it's about your happiness. You will be happier if you just kind of let things happen naturally as far as what you want to take, what direction you want to take in your life. As far as a warning, oh boy, as far as a warning, I would just kind of say, like, live out your teenage years and enjoy your high school years as much as possible. I know it can be hard. Like, I worked all through high school. And people aren't lying when they say you get to college and things get crazy. And being an adult gets crazy. Like, I've already had my own apartment for a while. And do you know how much work it is to remember to do laundry and to do dishes and and to, like, just crazy stuff you don't think of. Did you know you have to dust the tops of fridges? Or like things get nasty if you put them out there, because I didn't. But just enjoy your high school life and enjoy the lack of responsibility as much as you can, because things are a lot different in college and just in the adult world. And rent, like, you have to pay bills. Bills are awful. Paying rent is awful. Just enjoy while you have it.
All right, fair enough. That's fair. Okay, dust the top of your refrigerator. That's what we're gonna come out of here with. So it's anybody else want to take next stab at it there?
I'd say one piece of advice would be, when I want to say this, you don't know what's going to happen. Like I said, when I started school, I thought I wanted to work in the emergency room. That's why I was hard bent on that, and that's what I wanted to do. And then I fell in love with the ICU. So you never know what's going to happen. Take it, don't worry about if you do bad on a test. That's one test. I had a teacher in high school that said, you did bad on a test. In a couple years, no one's going to care that you did bad on one test. Just focus on it, learn from it, and do better on the next one. On the flip side, don't worry about tomorrow. Tomorrow's a whole day away. Focus on today. What can you do today that's going to make you happy? What can you do today that's going to help your career? So just focus on, just take it day by day, and you never know what's going to happen, especially working in medicine. My day can change in an instant. My warning would be, watch out for night shift. Night shift can be grumpy. But no, kind of like Emily said, take time, enjoy yourself while you're in high school and in college. When I was in high school, like I said, I got my EMT when I was 16. So my Friday and Saturday nights were hanging out at the fire department, working on the ambulance, which, don't get me wrong, helped me in my career greatly. And I wouldn't have changed. If I could go back, I wouldn't have changed a single thing. But I do wish I would have made some more friends in high school. Maybe, if someone, I had a couple friends that they would invite me to go fishing all the time with them, but I was, at the fire station, so I couldn't. Or, I had some friends from the band that, would do different things and be like, no, I really wasn't. Take the time, make a couple friends, because I'm still friends with, some of the people I went to high school with, but there's a lot of people that I was kind of friends with in high school, but I don't know, graduation day, never seen them again. And you wonder what happened to them. And college, you're there to learn, you're there to get your education, but it's a once in a lifetime experience. Enjoy it while you're there, and enjoy your time there, but while you're there, work hard and it'll pay off. I mean, I tell people all the time, I got my first nursing job when I was 23 years old. And at the age of 23, I had a college education. I had a nice pickup truck. I have my own house. All the bills and responsibilities that come along with it, but there's not too many 23-year-olds that have their own house.
Nice. Awesome. Thanks, Chris.
Enjoy your time, but take all the opportunities you can to learn.
Solid.
I'm pretty similar to Chris's. High school was like, for me. I mean, it was fun, I guess, but looking back on it, college was so much better. But generally the 20s decade is full of big changes and huge major life events that you'll never get to do again or shouldn't do again, I guess. So I don't know, if I went through it kind of with like, I'll never be at this point again, or at this point again, I'll never be a senior in college again, or a third year med student again. And what do I want to get out of this year? And I kind of went into every year like that. And I think I would warn my old self, I guess, about not being discouraged about small failures that seemed really big at the time. So I definitely failed a couple organic chemistry tests and thought that I would never be a doctor, and kind of rethought my career several times about that. And fortunately had support that would tell me that small things like that aren't going to stand in the way of a major career. But it would be nice if I had had a little more perspective at those times and realized that small things like that couldn't stand in the way. So yeah, it's a lot of fun in your 20s, and enjoy every bit of it and every challenge that comes with it.
Awesome. Well, I do appreciate all three of your guys' time this afternoon. Good luck to all you three presenters today. I know you're all, in your own stages and have your own challenges given the current events. I hope everything, works out for the best for all three of you. And again, I do appreciate you taking the time to share with our students some of your experiences and advice. And I think it's definitely been a worthwhile way to spend an hour. And it's been fun talking to you too. So nice to catch up. So
thanks for having us. Nice to meet you guys.
Thank you.
I hope all you guys stay safe. Everyone else watching out in the internet, again, thanks again for tuning in.
You mean coronavirus specific or just in general?
Or just in general. I mean, we can keep talking about coronavirus if you want.
I mean, any time spent not talking about it.
Yeah, but like in terms.